Why do I use Bulk EZ? I've used a lot of products, a lot of composites from the days when we only had two to choose from, and it's the confidence. That's the main reason I use it, because I trust the bond. It has directed shrinkage, so I don't have white lines when I polish the composite, and especially when you are looking at the bonds to tooth surfaces that are the most challenging, like dentin bonding, cervical bonds, bonding to porcelain or metal, where you really want the strength, and that's why I use Bulk EZ. Bulk EZ has replaced all of my flowable composites that I would use for lining, like posterior composites or first layers under heavier paste composite, and for many cases, and almost exclusively, I use Bulk EZ as the entire restoration. If I feel that there's a particular case, I'll cap it. But when I want the margin to be the best, I make sure that the Bulk EZ is the first composite touching the tooth. Well, as far as how patients react to the restoration, it's kind of like the way I reacted the first few times I used it. I placed it, I didn't see a margin, so the chameleon effect was even better than what I was used to. And I would turn to my staff and say, look at this tooth. And they would look, and you can't see the filling, and you just kind of pinch yourself. And so with my patients, with the ease of using intraoral photography, like with your wand cameras, I can take a picture before, during, and immediately after and just show the patient right away. It's better than a mirror. And I take those pictures and show them to the patient routinely, and they love it. And the older materials, the older technology is often right next to it on an adjacent tooth, and I'll say, the filling you don't see is what we placed. The filling you do see is the one that was placed 10 years ago or 5 years ago. And so how do patients react? They love it. How do I react? When the filling bond at that bottom of the box or at the cervical class 5 holds up beautifully year after year, that makes me feel great. What I like about Bulk EZ is when we have trauma cases where a tooth comes in broken in half and they bring the piece of the tooth, it's amazing how it is really beautiful and strong, and when you put that tooth, just put it back together, it can weld it in a really strong way. But because I trust the bond and the way the bond matures, and because it's dual cure, I've done so many cases in the last 2.5 years since Bulk EZ was introduced, and to see them not come back when you put half a tooth bonded back onto the base, it's just amazing. And so Bulk EZ in those cases is great. It has really nice opacity if you're trying to block things out. And when you have metal to block out, there are products like OP Mask, really strong opacers that you can use over the metal, and then put the bulk over it, and it'll mask out that white or cream colored masking material, and then you can layer your favorite aesthetic anterior restoration over that if you need to. But it's pretty remarkable. I'd give it a try.